Today, we are diving deep into a truly fascinating and, incredibly important new frontier in cancer research. We're talking about a whole new way of thinking about how to fight this disease at its most dangerous stage. So, let's get right into it.
One word. It represents the single greatest challenge in oncology: metastasis. This is, and there's no way around it, cancer's most lethal feature. And it's exactly what we're going to unpack today.
So to really get our heads around this new approach that researchers are so excited about, we first have to understand the villain of the story. We need a really clear picture of what we're actually up against. So what is metastasis exactly? Well, it's the process where cancer cells break away from that first, original tumor, and then they travel through the body to set up shop somewhere new. It's this spreading that makes cancer so incredibly tough to treat, and tragically, it's responsible for the vast majority of cancer-related deaths.
Now, for a long time, the fight against metastasis has been all about attacking the cancer cells directly. But here's a thought. What if there's another factor in play? Something that actually comes from inside our own bodies? This is where the research gets really interesting.
Just think about that question for a second. What if our internal environment, the chemical cocktail that's always flowing through our bodies, could actually be making it easier for cancer to spread?
Well, it turns out that's exactly what a whole new body of research is suggesting. Scientists are exploring this wild idea that our own stress hormones and other signals might be, without us even knowing it, rolling out the red carpet for those migrating cancer cells. So, based on preclinical studies, this potential connection looks like a kind of chain reaction. It all starts with stress. That stress triggers the release of certain hormones and signals. And those signals can then change the body's internal landscape, possibly making it way more friendly for cancer to metastasize.
Okay, so if our own stress signals might be part of the problem, the next logical question is, what can we do about it? And this leads us to a really clever strategy, looking for some unlikely heroes in places we already know, like our existing medicine cabinet.
The big idea here is basically interference. I mean, we can't just get rid of stress, right? But what if we could use certain compounds to block or just dial down the signals that stress is sending out? We could, in effect, cut the communication line that might be helping the cancer spread. Now, researchers are looking at this from two main angles. First, they're looking at repurposing what we call off-label drugs. These are existing approved medicines, think beta blockers, that are now being studied for brand new anti-cancer abilities. The second path is looking at common supplements to see how they might mess with these exact same stress pathways. All right, so let's get a little more specific. Let's name some names and look at some of the actual compounds that are under the microscope right now. This table really gives you a great snapshot of the whole strategy. I mean, look at this. You've got established drugs like the beta blocker propranolol and the diabetes med metformin, and they're being studied right alongside things you can find in any health store, like melatonin and ashwagandha. It just shows you how wide a net researchers are casting for anything that might be able to tweak our body's stress signals. But it gets even cooler. Beyond just looking at the general stress signals, some of this research is getting way more specific. It's zeroing in on compounds that might be able to stop a very particular, supercritical step in the whole metastasis process itself. And that critical step is a process called epithelial-mesenchymal transition, or just EMT. Honestly, the easiest way to think about it is this. It's the moment a stationary cancer cell decides to pack its bags, transform itself, and hit the road. It's what gives it the power to move and invade. So you can see why blocking EMT would be an absolute game changer. It could stop metastasis before it even gets started. And what compounds are being studied for this incredible potential? Well, laboratory data is pointing towards a couple of well-known players from the supplement world. Curcumin, that's the active compound in turmeric, and quercetin, which is a flavonoid you can find in a ton of different plants.
So let's pull back for a second. What does all of this mean? Where is this research actually going? Well, this isn't about finding one single magic bullet. It's about opening up an entirely new path forward in how we think about cancer care, especially within integrative oncology.
And this isn't just happening in a lab somewhere. Real-world evidence is what's really stoking the fire here. For instance, doctors have made clinical observations with the drug propranolol, noticing unexpected outcomes in patients, and that has really fueled more interest in these stress cancer connections.
What's so important to understand is that this whole emerging field isn't just based on one study or some one-off story. It's a hypothesis that's being built on several different lines of scientific evidence, and that's what gives it real weight.
These lines of evidence, they include those preclinical studies, hard laboratory data, and of course, those real-world clinical observations. When you put them all together, they paint a really compelling, though, still incomplete picture. It's so crucial to remember, this is an active area of research. It is not yet standard treatment.
And because this field is so new and frankly so complex, a tool has actually been developed to help people make sense of it all. It's called the OncoIntegrate Protocol Builder, and it's designed to give people a structured way to explore all the published research on these off-label drugs and supplements for themselves.
And all of this brings us to one final really big thought. The research we've talked about today opens up this profound question. For decades, we have focused on targeting cancer from the outside in. But what if the next great frontier in cancer therapy involves looking inward, at managing and changing our own internal state to create an environment where cancer just can't thrive? That is definitely something powerful to think about.